What are your first thoughts when you look at this dog? Is it something along the lines of, oh, it's so cute, or oh, it's so goofy? Now, what if I told you that behind that facade of cuteness hides a nasty creature? Hi everyone, we, Carmen and Li Qing, would like to present to you a neglected and emerging parasitic disease called Cystic Echinococcosis. This disease has a worldwide distribution excluding Antarctica and is especially prevalent in parts of Argentina, Peru, East Africa, and China, reaching a prevalence level as high as 10%. Populations at risk of this disease include communities that raise sheep, live close to uncontrolled dog populations, live a lifestyle of uncontrolled livestock slaughtering, and live in unsanitary conditions. Cystic echinococcosis in humans is caused by larva stages of the tapeworm called Echinococcus granulosus. Its adult form has flat ribbon-like bodies and is quite small, often not exceeding 7 mm. It has a spherical head called the scolex, containing 4 suckers, and a rostellum with hooks. Below the head is its short neck, followed by an arrangement of immature segments, mature segments containing its reproductive organs, and gravid segments containing as many as 500 eggs. Its adult form matures and reproduces in the intestines of its definitive host from the canine family, including dogs, wolves, and jackals, releasing eggs in their feces and contaminating the feeding ground of grazers. These eggs are spherical, ranging from 30 to 43 micrometers, containing a brown hexacanth embryo, and are surrounded by thick shell and clear coating. These eggs are extremely resistant to external conditions and are still capable of development even after months without a host. From there, intermediate hosts, including sheep, cattle, and horses, graze on these contaminated grounds and ingest the eggs. The eggs hatch in the small intestines and release their larva, called the oncosphere. The oncosphere penetrates the intestinal wall, migrates through the blood or lymphatic system, and enters various organs such as the heart, spleen, kidney, brain, but most commonly the liver and lungs, developing into a hydatid cyst. This cyst has an inner germinal and outer laminated layer, surrounded by a fibrous capsule. Daughter cysts bud from the layer and produce protoscolesis. The definitive host becomes infective when they ingest cyst-containing organs of the infected intermediate host, where the protoscolesis invaginate their scolesis, attach to the intestinal mucosa, and develop into its adult stage, therefore completing the cycle. Humans become accidental intermediate hosts when they ingest food contaminated with the parasite's eggs.
While the adult worms and cyst larval stages do not cause disease in their definitive and intermediate hosts, significant pathological changes occur in humans. Although humans can remain asymptomatic for 10 to 15 years due to the slow-growing nature of the cyst with a 1 mm growth per month, the cysts put pressure on surrounding tissues in the organ they are occupying. Cysts in the brain may cause neurological symptoms such as intracranial hypertension, epilepsy, and paralysis. Compression of the liver may result in jaundice, portal hypertension, and abdominal distension. On the other hand, cysts in the lungs may cause chest pain, difficulty breathing, and the coughing out of blood. Rupturing of the cyst leads to the release of hydrotic fluid and protoscoles, which cause severe allergic reactions and the formation of new cysts elsewhere in the body. An increase in cystic echinococcosis infections have been observed worldwide these past few decades, and not without reason. The global consumption of meat has more than doubled since 1990, which led to the large breeding of farm animals to meet the ever-rising demand for meat products, ultimately leading to an increase in intermediate hosts for Echinococcus granulus. Additionally, recent surveys found that the main source of infection in rural communities in Southeast Australia were farmers feeding possibly infected raw wild and livestock meat to their dogs, thereby promoting the life cycle of the parasite. In a separate study, it was discovered that the cessation of 6-weekly dosing of farm dogs with praziquantel in 1989 was met with a rise of 3.4 to 8.1% in the prevalence rate of the cystic echinococcosis between 1989 and 2002.
Nevertheless, there are several prevention strategies against Echinococcus granulosus, such as deworming of dogs, maintaining proper hygiene in slaughterhouses, and most importantly, raise awareness about the disease through education. With these, Let us all do our parts to reduce the risk and impact of its reemergence. Thank you.